Hi, I'm Colin Fincham. I'm the Chief Operating Officer of Intellehealth, in charge of the national program in the United Arab Emirates, which is implementing healthcare IT in 14 hospitals, 68 clinics, and 19 other facilities. We've currently got 14 hospitals live, and so I think I have a reasonable perspective on healthcare IT. One of the big things for me is about implementing and getting doctors to use IT. As Frank Davis said back in 1989, a computer system can only improve healthcare performance and organisational performance if it's used. There's no point in having healthcare IT if people don't use it. So I'm very much involved in how do we get doctors, healthcare professionals to use healthcare systems. One of the big problems is that everybody wants to save time. Everybody thinks computers saves time. But unfortunately, sometimes by actually needing to do what we need to do, which is save the patient, it does take a bit longer. One of the really important things is the most dangerous instrument in healthcare is actually the pen. It kills more patients than anybody else, much more than the scalpel, much more than x-rays, because people can't read handwriting. So I'm a great believer in computer physician order entry, where doctors enter the medications. They can get electronically transmitted, but that's not necessary. It can be just printed out. But what it does mean is that if a patient has an allergy or you prescribe something that interacts with something else, then it does mean that the computer system will pick that up. It'll save the patient's life, potentially. In the US, we spend there's 3.2 billion spent every year on iatrogenic or drug interactions and drug allergy interactions. So we can save money, we can save patients' lives. However, getting that message across to doctors is so much of a challenge. One has to very much explain that it's not about saving time, it's about saving patients. I think that there's three important bits to this. One is telemedicine is one application of e-health. Whether the patient is at a distance, whether the patient is in the same city, or whether the patient is sitting next to the doctor, technology can help. But you still need virtually the same technology. Sure, if you have a long-distance relationship, as in telemedicine, you're going to need faster broadband links. So Australia, for instance, are very much pushing to a fibre to every home. The UK are now moving to fibre to every home. So that fibre technology is going to be necessary. However, we shouldn't wait for telemedicine to allow e-health to improve patients' lives. E-health can improve people's lives by as simply as having a mobile phone and getting a reminder to take medication. I think it doesn't matter really where in the world it is. Healthcare is needed globally, and we heard today in the conference that of patients with diabetes globally, within 2 years, 1 in 5 of those patients will be in India. That's a huge number of patients with diabetes. Diabetes is a lifelong condition that needs to be managed, not necessarily treated. It may not be able to be treated, but social interactions, improving diet, reducing smoking, etc., that's important. So however Apollo decides to use e-health, it can improve patients' lives, it can improve their care and improve their health, be that via telemedicine, be that e-health, or any of those additional ways of doing it.